We're going to explore the celiac trunk, one of the most important arterial branches of the abdominal aorta. The celiac trunk is a major arterial supply of the foregut. It provides blood to the stomach, liver, spleen, pancreas, and the upper part of the duodenum. It usually arises from the abdominal aorta, at the level of T12, just below the aortic hiatus of the diaphragm. The celiac trunk is short, about 1 to 2 centimeters in length, and it quickly divides into 3 main branches. 1. Left gastric artery. This is the smallest and the first branch that arises from the coeliac trunk, and passes into the lesser omentum along the lesser curvature of the stomach to supply its superior portion. 2. Common hepatic artery. This branch arises from the celiac trunk and runs towards the liver. The common hepatic artery then gives off the gastroduodenal artery, and continues as the hepatic artery proper above the first part of the duodenum. At this level, the hepatic artery proper gives off the right gastric artery, to supply the lesser curvature of the stomach, and anastomoses with the left gastric artery. The hepatic artery proper then divides into the right and left hepatic arteries that enter the liver. The right hepatic artery typically gives rise to the cystic artery, which supplies blood to the gallbladder. The gastroduodenal artery branches into the right gastroepiploic, and anterior and posterior of superior pancreatico-duodenal arteries. They anastomose with their counterpart branches of the inferior pancreatico-duodenal artery, which is the first branch of the superior mesenteric artery. 3. Splenic artery, the largest and most tortuous branch. It runs to the left, along the superior border of the pancreas, to reach the spleen. Along its course, it gives off pancreatic branches, short gastric arteries to the fundus of the stomach, and the left gastroepiploic artery, along the greater curvature of the stomach.
Now we're going to look at the superior mesenteric artery. The superior mesenteric artery is the second major branch of the abdominal aorta, arising just below the celiac trunk, usually at the level of the L1 vertebra. Its primary role is to supply blood to the midgut, which includes part of the small intestine and the proximal portion of the large intestine. The SMA gives rise to several key branches. 1. Inferior pancreatico-duodenal artery. This is the first branch of the superior mesenteric artery, arising from its right side, and supplies the pancreas. 2. Jejunal and ileal arteries. Numerous small branches that form arcades in the mesentery. From these arcades arise the vasa recta, which directly supply the jejunum and ileum. 3. Middle colic artery. It supplies the proximal 2/3 of the transverse colon. 4. Right colic artery. This artery runs directly to the right, and supplies the ascending colon. 5. Ileocolic artery. This artery supplies the cecum, appendix, ileum. In order to reach the ascending colon, it passes downward and to the right.
The inferior mesenteric artery arises from the anterior surface of the abdominal aorta at the level of the L3 vertebra, just a few centimeters above the aortic bifurcation. Its primary role is to supply blood to the hindgut. The inferior mesenteric artery has 3 main branches. 1. Left colic artery. This is the first branch, which ascends toward the descending colon and distal transverse colon. It divides into ascending and descending branches, anastomosing with the middle colic artery, from the SMA, and the sigmoid arteries, respectively. 2. Sigmoid arteries have usually 2 to 4 branches. They supply the sigmoid colon and form arcades with each other as well as with the left colic artery. 3. Superior rectal artery is the terminal continuation of the ima. It descends into the pelvis, supplying the rectum and anastomosing with the middle and inferior rectal arteries.